Hey everybody, I want to talk about something that I have heard over my whole career, but actually this week it's came up in multiple situations, multiple times. And that was when one of my patients was going through something, and it was different in all three occasions. But what eventually came up was they said, hey, I went to see my doctor, whether it was their exam, insurance is starting over, they're trying to figure out their plan for next year, whatever it is. Or maybe they were going through something serious, and that was definitely one of these. But they talked to them about how they're managing their healthcare. And at one point, chiropractic came up. And I think a big part of that conversation was it's a big part of our patients' lives. Yep. And so when they said it kind of energetically. They were excited, like, oh, I see my chiropractor. And when they say that, they mean I'm getting adjusted. I'm taking care of my nervous system. I'm working on my nutrition. I go to their workshops. They have encouraged me to start exercising. They actually talk to me about how I'm managing my posture, my stress, and these different things. But when they say, oh, I go to see a chiropractor regularly, the medical doctor doesn't think about all of that. So in these instances, they pause. Sometimes the doctor looks kind of confused. In 2 out of 3 of them this week, they said my chiropractor actually like scrunched their face a little bit. They looked like they smelled a bad.
Medical doctor did.
Or their medical doctor scrunched their face like they saw smelled a bad sock or something. Mm-hmm. And they were like, they were not on the same page with me. And I found that was very interesting. In one case, they actually warned the patient, like, I wouldn't do that. I wouldn't do that. And this is a patient who has been a patient of mine for over 10 years. And they found that very interesting, and it had the opposite effect. And I want to be really clear in this episode. I don't want to like talk bad about medicine. I just want to acknowledge the fact that A, we're different, and B, they don't know what we know the same way that we don't study and spend all of our time on what they do. So the answer is simple when it comes to why would they do that? And it's our training's different, and they weren't trained to do what we do. And today, Ashley and I just really want to explain why our schooling, the outcomes, what the risk data says, even being full disclosure of bringing the receipts, so to speak, literally, of our malpractice insurance, and talk about this not with emotion or defensiveness, but just truth and separating the opinion of somebody from the facts of what's actually going on.
Yeah, and so let's if we dive right into, and I don't know, I like to kind of say a little piece of I think when I was younger and more eager inside initially when in this holistic realm of things, I was probably a bit more offensive. And I say probably is a generous term, in speaking about some things. Yeah. And here's the deal is that now we're at a point in our life where there's some wonderful, amazing people that are medical doctors, and we have friends that are wonderful, amazing medical doctors. And we're not talking about the human beings themselves, right? We're not talking about are these good people well-intentioned, or you know what I'm saying? Like, we're not talking about that specifically.
So real quick to interject and then keep going with this, but we have a friend who has another podcast, and it's more of kind of their chiropractors, but it's like local and social, and they have on all these guests from around. They'll have on the yoga studio lady and the new restaurant that opened up or whatever. But last week or 2 weeks ago, they had on 2 medical doctors. Yeah. One was a plastic surgeon and the other was a orthopedic surgeon who, when they were talking, it was not, this. Yeah. One of my patients said to me, I wish you guys would do this more. And I'm like, it's happening, but it's literally on a person-to-person, interaction basis. It's not going to happen institutionally.
Right.
I think that's where we get into this.
Right. And the fundamental differences of exactly where we lie. And so let's talk about one of them. And one of them is that medical education, exactly what it's built around, right? Like they are answering one primary question when you're looking at it, right? You're looking at what drug or procedure manages this condition. Yeah, and so that's something that kind of gets ingrained, like societally, like there's an effect of that, right? Because after so long, like this has been the primary driver. Like when you go to see a medical doctor, it's primarily like, oh, what's the condition you're in here for? Okay, here's my script. Here's how I treat it. Okay, there you go. And like you walk in and like that's kind of the interchange. And then when you have that happening in society for, my God, how long has this been going on? I mean, pharmaceutical medicine really in the 1920s is when it started taking over, but then it started becoming routine in society, 50s, 60s, 70s, 80s, 90s, I don't know. Like we're going all through there. And so now we've built up this thing where people are smart and they understand that they walk in and this is the transaction that's happening, right? We're just looking for a condition and then pill for that condition or procedure for that condition.
Yeah, break it down very clearly. It's you're having symptoms and then their job is to diagnose like what are those symptoms a sign of, and then that condition has a diagnosis code. And then that diagnosis code has a predetermined treatment and or options for treatment, which ultimately, and this may be hard to hear if you're in the medical profession, but this is the truth. If you have a diagnosis and you go right to looking at ICD-9 or 10 nowadays, and you look at what those treatment, what they warrant, there's predetermined drugs and or surgical pathways that go to those. We actually said that to a friend whose dad was a medical doctor and whose wife is a medical doctor. And he was kind of offended because the nuance of that says, oh, well, they're just taking information and plugging in numbers and then they don't get any choice in it. It's like, well, in reality, that's actually what's kind of happening in that part of medicine is that you're coming in and their job, and they're good at figuring out pathology. They're good at figuring out, is this, you're having chest pain. Is it your heart? Is it your gallbladder? Is it a pulled muscle? And they're good at that. But once they figure it out, that's where it ends because it's already predetermined for them what pathway you're going. That's where doctoring really isn't doctoring. It's diagnosis. And then it's handing it off to what the pharmaceutical and or surgical companies have decided the right protocol is.
Right. And what's interesting about that is that chiropractic education is built around something totally different. Right. Like it's a very, like it's such a different, and so when you walk in, it's that shifted mindset when you walk into someone that has a more vitalistic, not even a more vitalistic, a vitalistic, like it's a difference. Like there's a mechanism and there's vitalism. So you have somebody who you walk into a chiropractic clinic, a vitalistic chiropractic clinic, and they have a different, there's a different education behind it, right? They're looking for what interference is preventing the body from functioning the way that God designed it to. Yeah. Your body was designed to function a certain way. It's not. What's back here?
What do we cut out? What surgery do we have to do, or what drug therapy do we have to introduce to alleviate your symptoms? It's no, you're not healing. How do we get you healing? Right. And when I ask patients, and it's kind of an obnoxious question, so I don't even ask anymore. I just say it. I go, hey, if I were to have all of you guys in the room raise your hand, who wants more healing, who wants more vital, like who wants to live healthier, everybody's hand would go up. If I said who wants more drugs and who wants more surgery, everybody's hand would go down. And so right there, for me, that was what it was. When I became a chiropractor, I went through 8 years of studying, like, I think this is the funny thing of like, when people think about chiropractic being doctors, they think you like go to a weekend certification or something. It's like funny, but I went through 8 years of studying anatomy, neurology, physiology, diagnosis, differential diagnosis, radiology, spinal biomechanics, pathology, all this stuff. I'll tell you the very one category that I studied the least, in fact, almost none, was pharmacology. Pharmacology meaning knowing the drug names, prescribing drugs, knowing how to prescribe drugs, what amounts for what conditions, next to zero. And the reason why is we aren't even licensed to prescribe drugs. We are licensed in the state of Ohio where we're licensed to order tests, blood work, MRIs, CT scans, anything you want. We can do pretty much everything else, but we're not allowed to do one thing, and that's prescribe drugs. And the reason why, we're not studying them. But when I look at the converse of that, and you look at, okay, what is it that's different between the two? And that is we spent a lot more time in radiology, neurology, nutrition, and all these things. And where in medicine, typically they have 0 to 1 hour on basic nutrition. They spend far less time in radiology. They spend way more time in pathology, studying disease, and way less time in studying vitalism and health. And then they spend an inordinate amount of time on pharmacology, tons of it. In fact, I would even say that when they study anatomy, when they study physiology, they're studying it actually as a pharmacology course.
Right.
They're taught medical terminology and some pharmacology. Like they call it medical terminology, but most of the medical terminology is actually conditions and drug names. Mm-hmm. And then they're taught anatomy and physiology through the lens of pharmacology. So right off the gate, it's very, 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 very different. And so when your MD says, I don't understand chiropractic, what they're really saying is, I've never looked at the body that way.
Right.
I've never looked at it through that lens. And to me, when I hear that and a patient comes and tells me that, it happened 3 times this week, it's not an insult to me. I actually smiled, and in one case I was laughing. I'm like, they just don't get it. They just don't get what we're doing. We're doing different things.
Right. It's not an insult to them either. Like, let's be honest. Like, it's not an insult to them. It's just very 2 different paths.
Yeah, it's different. I mean, you know, if you have a nice pair of shoes and you want them repaired, you take them to a cobbler. If you have a bike that's broken, you take it to a bicycle shop. If you have a car that's damaged, you take it to a car shop. I'm not taking my shoes to a car shop or my car to a cobbler. I know that's weird, but
I couldn't find a cobbler right now. If you said find a cobbler, I'd be
there are cobblers around. Cobblers and people who fix nice watches. They're really hard to find, but nice shoes and nice watches.
It would be a deep Google search. It would be.
You'd find a cobbler.
Maybe
we used to take our baseball mitts. This is a true story. We used to take our baseball mitts to a cobbler. Because if you have a baseball mitt, it's like something that's near and dear to your heart, and you don't want to get rid of it. You love this thing. You put it under your mattress. You threw a ball and do it hundreds of times. You put it in the oven. You rub mink oil on it. And the reality is, once you got this thing to the point where you want it, you don't want to break in a new one. So if you break a string, if you break part of the webbing, you take it to a cobbler and they just replace that one piece. And you're like, yes, it's my mitt. It's my thing again. And that's how, like, this is weird, but I look at my body that way. Like, I'm not trying to get somebody else's heart. I don't want a pig valve. Yeah. I don't want to, like, tell me how to keep the body I have and keep this body I have as healthy as possible for the rest of my life. Maybe I have something in the rearview mirror I missed. Maybe there's a blind spot, but how do I get back on track? And that's what I loved about chiropractic. And I think this brings to the next point. That's how we've raised our kids.
Oh,
like
absolutely.
You as a mom.
Absolutely. When our kids were little and they were sick, let's say we didn't use the word sick a lot in our house. We were talking about expressing symptoms of health, right? So, health and healing.
You're healing.
Yeah,
you're healing.
Symptoms of healing. So when they were small and something was wrong or something it was abnormal, they weren't in a state where they were functioning at 100%. My first question wasn't, what drug are we missing? What pharmaceutical drug are my kids missing?
Do they need an antibiotic?
Yeah. Like, that wasn't the first thing that I ran to. That wasn't even in the thought at all. Like,
which goes to the bigger philosophical thing is, we don't believe when they're quote unquote sick, right? We call it, like, expressing symptoms. They're fighting something off. Mm-hmm. They're having a healthy immune response. We don't think, what antibiotic are they deficient in?
Right.
They're missing an antibiotic. That's got to be the key.
Right.
That's not it.
And let's be honest here. Most of the time when that's going on, you can sort of backtrack, like you can take a few steps back on there and you can go, why isn't their body adapting?
Oh,
like,
it's Halloween last week.
Right. If something is wrong, you can backtrack. We were talking about this with my son because they had a lot of kids. They actually canceled a few
whole
days.
Week of, almost a whole week of school.
Almost a whole week of school because there's so many kids in the grade that were sick. So we sat down and we said, hey, think this through. Like what is it? And why was half your grade okay? Like what was going on that half your grade was still there and they were showing up to school and they weren't expressing these symptoms of healing. Yep. And the other half was, and they were all home and they were, resting and getting better. And so we talked about, there was a big dance on Friday night that your school had. And there was a lot of really unhealthy food there. And there was a lot of really unhealthy drinks there. And you guys stayed up really, really late. And there was all sorts of things that was going, and then I was like, there's a lack of vitamin D. It's wintertime. There's all of these things that kind of go into it.
And so some people were adapting poorly because they had done X, Y, and Z, and their body from inside out was trying to express health. But from outside in, they were doing things that were an insult and assault to their body, and it was lowering their resistance. And from the inside out, we believe these kids should all be getting adjusted. We believe that their nervous systems are actually a huge part of this. So are any of these kids getting adjusted? Yeah. Half of them or more are sick. Half of them are showing up to school okay, and they canceled everything because they don't want the sick kids to get the unsick kids sick. And so it's like, cancel school, all that stuff we told you was really important right before Christmas or break or whatever. Like, we're not going to do any of it. We're going to cancel school. Sure. But it goes to this whole idea of, is it we need treatment or we're not adapting? And that single question's huge. Right.
And you can approach it a little more rationally then. Like, it doesn't feel, I use this example quite a bit, but it doesn't, sickness doesn't feel like a lightning bolt when you understand, when you can sit down and you can kind of do the math on our kiddo was one of the ones who was fighting some of those that he was expressing some health and healing there. And so we were able to kind of backtrack and walk him through and say, hey, let's talk about what your choices were. Yeah. Let's talk about the lack of sleep that you were getting. Let's talk about, all of these things that added up. How many times were you getting adjusted in the past few weeks?
I actually reviewed that with them. Like what was your adjustment schedule over the last couple weeks?
Yeah. And so all of those things came together. And when you added the point total up, you were like, oh, wow. Every single day, if you were making a check mark in the health category or the disease category, your check marks were adding up over in this sickness and this disease and this not well state way more than they were over here in the health category. And so no wonder that happens. And so we were able to really back that up to say, to be able to say, what's gonna happen in the future? Yeah. What kind of choices are you gonna make in the future?
And I think that lens is the most important thing, because that's the lens we're talking about when you're trained in pathology, when you're trained and there's a drug for every condition. When you're trained in this, then you view it through this lens. You're like, I'm sick. Oh, I need to be healthy. How do I get healthy? Oh, medicine tells me I go see the doctor and I take a thing, whatever the thing is. And the chiropractic lens says, oh, I don't feel well. I'm sick, in quotes. I'm actually adapting to things I've done. Yeah. What do I need to do? Oh, I need to rest. I need to take vitamin D, C, and zinc. I need to get adjusted more. I need to rest. And what's interesting is it's vastly different because they both recover, right? Ideally, they both recover. Mm-hmm. But one is actually building. It's like going to the gym and getting stronger. And on this chiropractic side, it's this lens of like, no, we're this vitalistic thing that needs to continue to adapt to stress. And the other side says, no, you're just broken and you just need more drugs. But ultimately, what we know is that pathway doesn't lead to more health. It leads to more disease over time.
And that we've talked about this before. There is data. There are studies that show that when you fight off illness without the use of those antibiotics, that builds a significantly stronger immune system.
Yeah, absolutely.
To the tune of even the studies that we've read before that say that childhood measles was something that allowed children to, in adulthood, fight off cancer.
Yeah. In fact, to the point. Study. Yeah, and it wasn't just that childhood measles. Kids who had childhood measles in the future had less incidence of cancer. They took that all all the way to, and this was on Vice News at one point, they took it all the way and extrapolated. I can't remember who was doing it, but they were actually starting to inject that measles virus back into adults who had cancer, and they were showing that it was actually having pretty profound effects on beating cancer later in life. So they said, we could use this retroactively, but that's not how it was meant to be. You were actually intended potentially to be, maybe not get measles, but at least be exposed to measles so that you developed immunity, because not everyone who's exposed to measles expresses dots all over their body and a high fever for a few days and then recovers really well. Yeah. But the vast majority of people who are exposed to measles don't actually even get measles, but they develop immunity to it. And then the research showed that it actually has an effect later on in life for your future immune system. This is crazy. This is why, as a chiropractor, the studies that have come out showing long-term chiropractic care, when your primary healthcare provider was a chiropractor, meaning anytime you have a problem outside of don't get me wrong, like if you got to call the ambulance, don't go to the chiropractor in most cases. Like, broken arm, there's a bone sticking out, a knee that just got destroyed in a football game or a car accident where, there's potentially, punctured lung or whatever like that. That's not the time to go to your chiropractor. There's potentially life-saving things, and this is where we appreciate medicine. But when people who just weren't feeling well, or they had pain, back pain or whatever it was, or there was some condition going on, and they went to their chiropractor first, what they found was, on average, there was 60% fewer hospital admissions, 59% fewer days in the hospital, 62% fewer outpatient surgeries. So 100% of people go in. If they're under chiropractic care, 62% of those less were ending up under surgery, and then 85% lower pharmaceutical costs, meaning that they were taking 85% less pharmaceuticals, right? That's where the cost comes in. So it wasn't just pain relief. This was like whole body health, whole system health. And it was less intervention, less dependency, less breakdown of everything.
And that's wild. Like, those numbers are staggering, right? When you look at them. And it's wild to me. That is how I know for a fact that if a patient comes in and they say that their medical doctor scrunched their nose and like made a weird face that they go see the chiropractor, I understand that they just don't get it. Like, they just don't understand what we do. They just don't understand what chiropractic is.
Yeah,
they don't understand the benefits that happen, philosophically speaking.
And
right?
we're not saying, I'm not saying everyone's going to agree with us. Like, right. Philosophically, we're not saying like everyone has to do chiropractic. I think everyone should. You have teeth, you brush them. You have a spine and nervous system, you should get adjusted. I really believe that. But there are people who smoke cigarettes. There are people who, choose to eat terribly, like things I wouldn't choose for myself. So there are people that are choosing other ways. You have the freedom to do that. That doesn't mean smoking cigarettes is wise. It doesn't mean ignoring your spine and nervous system is wise. It doesn't mean that your outcomes are going to be better.
Right.
It just means you have the freedom to choose, and we respect that. But at the same time, when we get the disrespect back, right? The turning up the nose, the scrunching of like, oh, you guys see a chiropractor. I'm like, it clearly indicates that these people that are trusted medical professionals, they just don't understand.
Right.
And I think that's where I view that.
You would look at a patient with and you see those outcomes that are 60% less hospital admissions. And for the people that do end up going to the hospital, 59% fewer days in the hospital, 62% fewer outpatient surgery, and 85% less pharmaceuticals costs. You would be like, hey, patient, get your butt to the chiropractor. Right? Like, you would look them dead in the eye.
But here's the crazy thing.
Come on.
Sometimes they get the opposite. Sometimes they get the opposite. And this is the one that really irritates me. Is it's not just the like turning up in the nose or like the, like you smelled a bad sock or something, that face that they make. Mm-hmm. Oh, you see a chiropractor. And it's a patient that's been going to me for like 10 years and they're like, oh, chiropractic. And every now and then there's a conversation like, why do you do that? And I actually appreciate that. Like, I think it's a good thing to ask questions. Why do you do that? Like, what do you think the benefit is? I would be okay if an MD said that, but every now and then, and unfortunately it happens too often, is they'll say, instead of saying, why do you do that? They'll say, I wouldn't do that. I wouldn't do that. They could hurt you. Don't take your kids. Like, these are things that I actually hear, and I'm sorry, but I actually laugh. I laugh when a patient tells me, I'm like so stupid. They don't even get it, because I'm going to give you, here's insurance companies don't care about our philosophy. They don't care. Do you think health comes from inside out or outside in? Do you think you're deficient in antibiotics, or do you think God gave you everything you need with inside of you? Like, an insurance company doesn't care. What do they care about? One thing and one thing only.
Right.
What are the outcomes? What's the cost? What's the risk? Yeah. And they have actuaries, like people they pay a lot of money.
Yeah, you got data models, you got spreadsheets.
And then their primary concern is profit.
Yep.
And so they're betting on us, and they're making educated bets. So here's what the average annual malpractice premiums for different professions are. Chiropractors, every year I spend a whopping, and mine's actually lower than this, but this is the average, I spend a whopping $1,600 on protecting myself, up to $3 million for any particular incident. Yeah. I spend a whopping $1,600 a year because chiropractic is just that dangerous. Right. But your family medical doctor spends over $10,000 a year for the same coverage. Right. Internal medicine, blood pressure, diabetes, etc., over $14,000 a year. Surgeons, $30,000+ a year, depending on their specialty. I've heard of neurosurgeons and that stuff being way more than that. Mm-hmm. But a surgeon, so low-end surgeon would be stitching up your skin, maybe doing whatever, but then you get into heart surgery, that's going to be like significantly higher. OBGYN, $40,000 a year. What are these numbers based on? They're based on incidences that actually happen, injury, and things that go wrong that actually happen. And then the other one is risk, that maybe this didn't actually happen in your office, but the potential risk in your office. So, and then the last one is claims made against you as a professional. But if you average it out in this list, OBGYNs, which is childbirth, right? Like giraffes give birth in the zoo, deer give birth in the woods. People go to hospitals, and that's the highest risk thing on this list, which is crazy. But chiropractic is literally the lowest risk of any healthcare profession in the country. I haven't looked up dentistry, but I'm willing to bet dentistry even is way higher than ours, because ours, like, they still use drugs. We don't. There's still dental surgery. We don't, right? And like, I think you should go to a dentist. Yeah. I'm not, out of all the things medically, like, that's one that I really actually believe in, is that you should go to a dentist. Right. But again, no drugs, no surgery, no chemical overrides. There's precision with our care. We take x-rays. We actually work with the body. We're actually analyzing things. And this is where I think most medical professionals, when they come into our office, are surprised, because they're like, wait a minute, there's a precision about this care. They're working with the body, not against it, but they're actually doing it in a way that's like precise, and it's organized, and it has intentionality. And I think that they just think like we're like the wild, wild west out there, and we're just like, you know what I mean? Like throwing lassos, pulling people in, and then just kind of going from the hip and figuring it out. No x-rays. Get on the table. Let's crack some stuff and see how you do. Like it's so crazy. No.
Sorry. And so literally, if anyone ever tries to tell you that chiropractic is unsafe, that is categorically untrue. And it's not about feelings and emotion. There's data right there to prove it. The data says that. There's no need to discuss it anymore. When the data says that, hey, it's just not. It's literally just not.
And I'll just tell you guys, like, I don't need the data personally. I don't. I love it. I love to be able to share with you guys, but I don't need it because I experienced it. Like, I was a chiropractic patient, and this is the part that I love. I didn't grow up healthy. I actually grew up with ear infections. I was medicated. I remember like taking Benadryl. I talk about this, that we took Benadryl so often that we had our own little like alligator shaped Benadryl spoon. Like, it didn't come with the Benadryl. Like, we went on back then, it would have been like Amazon or Etsy or something. And like, I don't know where my mom got it, but it was an alligator. It was a green alligator. We had a custom.
She's like, this is going to be fun.
A custom Benadryl spoon or children's Tylenol or whatever. Yeah. And then I had ear infections. I had tubes. I had my tonsils removed. I had my adenoids removed. I had skin issues. And then chiropractic entered my life, and my body started doing what it was designed to do. The chiropractor started adjusting my upper neck. The interference got out of the way, the subluxation was corrected, the nerves started to heal, and my body began to respond. And then what happened was it restored function, and all my stuff went away. I had tubes in my ears 3 times, and it wasn't getting better, it was getting worse. I started getting adjusted, and the tubes just fell out of my ears, and I never had an ear infection again. I got my tonsils removed, and I still had throat infections. And then I started getting adjusted, and they stopped. And then years later, our Hudson was born, and he was unresponsive at birth. And it was a gentle adjustment that when I adjusted his upper neck, and I talk about this frequently, and if I go into detail, I'll cry, but I adjusted his upper neck, and he went from being unresponsive to literally like life coming back, color and breath, and everything started working, started peeing all over the place. And that was it. It was just... He didn't have a condition, he had interference. And so for me, I don't need convincing, and I don't think most people need convincing or data or facts, whatever, but they need to experience it. Mm-hmm. And I hear that so often as patients don't understand. And a patient was telling me this week, he's like, I'm telling my family, whatever, and they're like, you're crazy, why would you ever do that? Nah. And I'm like, they've never been adjusted. He's like, no, never. I'm like, if they don't know what you know because they're not doing what you're doing. Mm-hmm. If they just experienced it, number one, they'd be like, wow, that was different than I thought. Mm-hmm. That actually wasn't scary. It wasn't painful. And they get up, and what's crazy is the number one thing people say as soon as they stand up, they're like, oh my God, I feel different. Mm-hmm. And then the second thing they tell me is, I can't believe how good I slept last night. And if you guys understand how the nervous system works, sleep is an indication of parasympathetic healing, and that they're actually healing, and they don't know how to express that or say that, but they know what they felt when they went to bed and they woke up and they're like, oh my gosh, I slept great. And then that whole pathway just ensues. Right.
You have a friend who isn't sleeping well. You have a kid who isn't sleeping well.
They're not healing.
You have babies who aren't sleeping
well.
They're
under distress.
Take them into a chiropractor's office.
If you have a kid or a family member that's not sleeping well, it's a clear indication that there's distress on their nervous system, and that person is headed toward illness. Like, it's not like, oh, we got a kid who just doesn't like to sleep. No, that's not true. If they don't like to sleep, that means there's something interfering, and there's something distressing their normal sleep activity, and it's neurological in most cases, and that means that's an indication that they're not healthy right now, and every day they get less healthy, and that's the concern. That's why we take it seriously.
Absolutely.
The real reason your MD doesn't get it, your medical doctor, might not understand chiropractic. There's a couple key things. They weren't trained to now. Before I say this, I don't want to make it sound like they're just not trained like we are. They aren't trained like we are. They're trained totally different, and they're trained in a lot of things, and they have a lot of education, and they're very intelligent people. But again, it's the frame, it's the lens, and it's different. They were not trained to assess subluxation. They weren't. Subluxation is when those vertebrae are putting pressure, damage, stress on the nerves, and they're out of their normal position. They were not trained to measure whether there's any neurological interference until it becomes pathological. They weren't trained to restore function in your body without drugs. They weren't. Mm-hmm. If you go to your doctor and you're like, I want to be healthy, they're like, well, you have eczema, here's a corticosteroid. Like, how's this going to make me healthier? Well, it's not, but it's going to get rid of your itchy redness. Like, here's an itchy redness right? We were talking about this the other day. We had a girl that came in. She had something going on in her underarms. And the doctor goes, oh, it looks red. And is it itchy? She's like, yeah, it's itchy. He's like, here's the red prescription. Here's the itchy prescription. Literally. She's like, well, what's causing it? He's like, something's causing it to be red and itchy. So here you go. And it won't be red and itchy. But it's not correcting the cause. The first question I asked her, and she's a patient of mine, so she's already getting adjusted. We're already looking at her body very, nervous system centric, holistic. But I go, what do you use on your underarms? She tells me. I look it up and I look at the chemicals in it. I'm like, oh, these are irritants known to cause red and itchy. Yes. One of them was, I think it's propylene glycol or whatever, and it's a chemical that most people don't react well to. And we already knew her health history, that she's very sensitive to things. I go, just stop using it. 2 days later, she's doing great. And the person who deals with skin looked at skin and goes, red and itchy, here's the red, here's the itchy. But they didn't say, what are you doing?
Yeah.
What are you doing? Are you putting anything on it? Mm-hmm. Are you using anything? Like, what are you using? Let me look at that real quick. Because they're just not trained to think, and I hate to say this, but it's actually true. They think downstream. Mm-hmm. They think disease. They think pathology. They think dysfunction. They think, where are you going? How do we stop it? How do we slow it? Because, you're going to die. So how do we just make you more comfortable and less symptomatic as you continue down this crappy pathway towards death? And we're going no, you're vitalistic, something's going on, and that's a sign. Your body's telling you something. What's interfering with your vitalism? And so that I'm just going to be honest, we think upstream, and they don't.
Right. And how, and it is 1,000,000% valuable for them to be thinking downstream in an emergency situation. In an emergency situation, downstream.
If blood's pouring out, pouring out.
Downstream.
Yeah. If there's a limb or whatever.
Do not ask questions about what kind of deodorant I'm using.
Yeah.
If I have a limb missing. And if it's going. It is 1,000% wonderful that they think downstream in emergency situations.
But that's not the pathway to health once the thing is resolved.
Right. So we're not talking about those emergency situations. We are talking about somebody who's living their day-to-day life, and they want to express health to the fullest in their day-to-day life. You have something going on in your day-to-day life where you're like, oh, this isn't right, or this doesn't feel well, or I don't sleep well, or all of the different things that happen that aren't, you were just in a car accident and you have a bone protruding from your body. Do you know what I'm saying?
So I have 4 things that I think we do differently, and I think you're more eloquent than I am. So I'm going to name it off, and I want you to riff it for 10 to 15 seconds in each one of these, or more, whatever. Just go. Here's what I think that we teach our patients is we want you to honor God's design.
Yeah. So I think that unfortunately what happens in a traditional medical scenario is that it is always hyper fixated on the idea that you are missing something. That your body's missing something, that you weren't built right, that you have a Benadryl
deficiency.
There is something in your body that just that it's not right, and there's something out here in the world and the atmosphere and the ethos and the whatever.
Your breast cancer is genetic.
Yes, that you got to grab, or that something has to be fixed, and that it doesn't reside inside of you. It's outside here, and it needs to come in. And there isn't this idea that it's in here, but how do we express it better?
And who designed it?
God designed it.
Right. It's beautiful.
Right.
And we believe that. We trust that. We have a lot of patients that come in. We have a huge picture of Jesus in our office, and people just see it, and they don't even know who we are yet. And they're like, I like that.
Right.
I don't know what that is. I don't know why it's there, but I like that.
Right.
But it goes back to we honor God's design. Number 2, trusting the body's intelligence.
Ooh, this one's so big, and we talked about this a few weeks ago on the podcast, and there is something really hard about the idea when you've been through health issues of trusting your own body. And it's very easy for somebody to walk into your life and to speak something into you that says, do not trust yourself. Do not trust your body. Do not trust your instincts. Do not trust yourself. Do not trust your health. Do not trust that the fact that your body is always fighting and conspiring on your behalf. Because if you're running into a health issue, the easiest thing to do is to look at somebody and go, well, that's because you're broken. Well, that's because it's bad. Well, that's because you really need me because I'm going to write you this prescription or I'm going to do this surgery for you or I'm going to fix you. And you cannot trust that your body is going to do it on its own. Yeah. It's always abdicating your authority and your responsibility over to somebody else. And this is the one that gets me. This is the one that's like a knife to my gut. And this is the thing that, like, if I walk down the street and God forbid I get hit by a car tomorrow and I'm not here anymore, I want my kids to understand for the rest of their lives that they were born, that God put every single thing inside their body that they needed, that they were born perfect, and that all they need to do is to live inside of that design, to operate in the ways that the body needs to, and that your body is intelligent, that your body knows what to do, and you have that power inside of you, that the greatest doctor in the world is the doctor that's already inside of you. It's not somebody outside of you.
And the only time they ever acknowledge it, when you go in, they don't talk about your nervous system. They don't talk about anything. What they will say sometimes, if you have diabetes or high blood pressure, is you got to work on your diet and exercise, which is funny because they take 0 hours in exercise and they take 0 to 1 in nutrition.
Right.
And so people are like, well, my doctor told me I need to work on my diet and exercise. I'm like, all right, what'd they tell you? Well, they printed this thing off and it looks like they Googled it.
I know.
It's a Mediterranean diet or something. It's crazy.
Yep.
All right.
And if you remember when I was pregnant, we had a doctor who said, you need to work on your, he was like, just make sure we need to focus on nutrition. And I remember taking a second and I was like, I wonder what this guy's going to say. And I was like, what does that mean? I was like, how would I work on my nutrition? And I remember, I think that everybody just typically goes, yep.
Okay.
Yeah,
I'll work on it.
Yeah. I'll work on my nutrition. And I remember just stopping and going, what does that mean? What should I be doing? And I remember him just kind of pausing and looking at me and going, more green. Very well respected. Yes.
In the holistic community.
Yeah.
Very well respected. But again, very well respected. OBGYN, whose malpractice insurance is $40,000 a year, goes, more green. More green.
And I was like, I mean.
Cool. We're doing colors now. All right. Corrects cause instead of managing symptoms. Go quick on that one. I think we hit that a lot.
Yeah, I think that we hit that a lot today. I mean, that's essentially fundamentally, like when you talk about the difference between the medical system and chiropractic mechanism versus vitalism, like that is correcting the cause versus managing the symptoms, is that when you go to a doctor that wants to manage symptoms, like that's what it is. It's pills and surgery. That's symptoms. That's managing symptoms. Mm-hmm. When you want to correct the cause, when you want to get down there, and listen, that's trendy. I mean, you want to get trendy, just say root cause. We get to the root cause.
People say root cause, and then everything you look at is all symptoms. Like everything they're doing, like we deal with root causes, and then you look at what their actual treatment plan looks like. It's like that's all symptomatic. Mm-hmm. Root cause is upstream, going back and asking questions like, where did it start? How long ago did that happen? Whatever. We have people that come in, they're having neck pain, and it's the car accident 40 years ago, or it was their C-section birth, or it was whatever. And it's crazy, but the root cause sometimes is way upstream. And all right, last one, and I know you love this one: building generational health.
Oh, this
is where it's not about, like, I had a guy today, Tony. I love Tony. Tony's like, he's almost, I think he's 70. His knees messed up. His back's terrible. His neck's been a problem. Like, we're helping him through everything. He's doing great. Today he's like, my neck, doc, it's great again. Range of motion. I'm excited about golfing this summer or whatever. And my knee, he's like, but I've been at these cocktail parties and I can't stand for longer than 15 minutes without my back bothering me. I'm like, all right, Tony, so we're going to be back. But I'm like, Tony, I didn't start seeing you until 10 years ago. You're 60 years old and you were a train wreck. I've taken care of all 4 of your daughters. Make sure your daughters stay under chiropractic care. Make sure your grandkids get adjusted so they're not where you are when they're 60 or 70. Got it? And I'm like, dude, if you were a racehorse, I wouldn't buy you. I'll take care of you. I love you. But if you were a racehorse, I wouldn't buy you. So let's make sure that your kids live out a total. Isn't that what we want? We want our kids to do better, be more educated, hopefully earn more than we do.
Yes.
I want my kids to live longer and healthier than I do.
Yeah. And like, so here's the thing. Here's what's interesting about generational health is that, like I look back on my life and I remember every single day of my life until I moved out and went to college. My dad woke up earlier than me, got up earlier than me, and he pulled out this
10 almonds,
archaic Acme juicer. He bought a juicer in college.
Like a Jack LaLanne. It was before Jack LaLanne.
Well, no. They loved Jack LaLanne. They heard about juicing. They heard juicing was, like a way to health. And my parents didn't get it all right, but there were some things that they definitely got right. And he pulled out this archaic Acme juicer. And you had to buy these like strips. They were like strips of like, it was like a filter. Okay.
Yeah, like,
and we
like
had
terry cloth or whatever.
Yes. They're like, and you had to take this long strip out and you had to make it into a circle and you like dropped it in and then you had to like press the circle, the filter, like around the juice, right? And every single day.
Like if you had to make your own coffee filter.
Yes, kind of like that, right? And you had to like put it in there, and then you turned the Acme juicer on. It had a little metal switch, and you turned the switch on, and it had this big red plunger in it, right? And every single day he would, and now I'm not sure why he did this part, but he would clean the carrots, and he would peel the carrots, and he would cut the ends off of them. Which when I juice now, I don't do any of that.
No.
Like I just
dirt and all.
Yeah. Dirt and all. You got to eat a bushel of dirt before you die. So I don't do any of that now. But he
probiotics.
Yes, probiotics. He cleaned all of the carrots, and then one by one he juiced carrots every single day, and then he set 10 almonds out, and every single day we drank carrot juice, and we did 10 almonds.
8 10 almonds.
Yes. And my brothers did it, and I did it, and he did it for all of us. And it was like one of those things that we did our entire life. And I had live enzymes in my gut every single day of my life for my entire life. And there was other stuff that I did wrong that was silly, but at least I had that going for me.
When was the first time you got adjusted?
When I met you. I met you was the first time I got
I did not eat 10 almonds and drink carrot juice every day my entire life. And I did have gut issues and I had skin issues. It was a very different. But the one thing we did do was we began getting adjusted when I was 8 years old. So this is the thing, is people come at it from several different pathways. And we were never vaccinated when we were kids. I never had a single vaccine when I was born. I was vaccinated till I think 6 or 8 years old.
Right. So there was different things that we were all doing. And there was pieces of this generational health that we had. There was wonderful pieces that my parents gave me and they built for me and they instilled in us. And we own juicers now. And none of that is like, none of it's new. None of it's different for us.
Raw juice bar in our office.
Now, right? And those are all things that were generationally given to us. They were blessings that were handed down to us. They were like our faith in God.
They came from your MD, right?
Yes, no. Wait, I was like, wait, what? No, that didn't come from that. That was literally my parents doing the work and handing it down. And so one of the things that's so critical for all of us is that handing down those generational things.
Yeah, right now.
What are those gifts that you're giving your kids right now? What are the things that you're building into your kids' lives right now? What are the things that they're watching you do? Because you can't sit there and be like, you have to eat good food and I'm going to sit here and eat French fries.
And if your thought right now after listening is like, wow, I need to start chiropractic care, what you should be doing is going, I need to get my kids in there.
Right.
Like, yeah, you should be getting adjusted. Don't get me wrong. But if you don't go that next step, I don't get you. Like, I literally don't get you. And I want you to be healthy. I understand when you're on an airplane, the plane's going down, it's crashing. Who do you put the mask on first? Yourself, because you're no good to somebody else. If you can't breathe, you're dead. Right. But at the same token, the whole goal is like, if I was on a plane, I knew I was going to die or my kids were going to die, who do you think I'm picking?
Right.
I'm going first. I'm going to die. I want my kids to live. So it's you, and generational health is about wanting better for your children. So that's the next step. And I think that medicine doesn't acknowledge that. They're like, your mom had cancer, your gun's already preloaded. Right. Good luck with that. Right. You know what I mean? And that's sad. So in closing, I just want to talk about, like, you don't need your MD to believe in chiropractic. I don't require their belief. I don't give a rat's tail what they believe. I just need you to understand why you do what you do. I need you to understand that your health is not meant to be managed. It's meant to be restored. That chiropractic isn't here to replace medicine and never will. If you lose your arm, don't come to me. You know, in a car accident or whatever, you can come to me afterwards. You still have a spine. You don't have an arm. But the reality is that your nervous system, this whole idea that chiropractic isn't trying to fill a gap. We're not trying to fill a gap. We're trying to help you live out your best life, so you have to rely on that less. When the doctor's like, why do you go to chiropractors? Because I don't want to see you more.
Right.
I want to see you less.
Right.
Like, that's the idea, is we want these kids to get adjusted so much and be so healthy that they require less medical treatment. It's about removing interference, restoring function, and really living life fully alive. That's what chiropractic is. Together, I think we can really start changing this and transforming it. We talk about Maha. This is how we do it.